So good evening everybody. اليوم إن شاء الله حنتكلم على bugs and infection, mainly infections in pregnancy. Okay. الموضوع شوية طويل، حاولت أبسطه قد ما أقدر لأنه هذا من أرذل المواضيع صراحة في النساء والولادة. So which of the following is not an intrauterine infection? Parvovirus, varicella-zoster virus, rubella ولا الجونوريا؟ طبعاً أول ثلاثة اللي هي البارفوفيروس والفاريسيلا زوستر والروبيلا, those are viruses that can be transferred transplacentally to the fetus, so they are intrauterine infections. Gonorrhea is not an intrauterine infection. So we're going to start with the varicella zoster infection. Varicella, it's a double-stranded DNA virus. 95% of adults have serological immunity. يعني when you were a child, you will probably exposed اللي هو chicken pox اللي هو العنقز. 95% of the population are immune. It's transmitted by direct contact or respiratory droplets. The incubation period حقته بيكون from 10 to 21 days. It's highly contagious from day one before the onset of the rash until the lesions crest. يعني most infectious period حقته بتكون one day before the onset of the rash until نفس الراش هذه الليجنز يصير عليها زي الطبقة زي الكريست كده. طبعا هذا الشكل اللي هو الchicken pox. Okay, so you can see كيف هذه الcrested lesions، هذه الcrested lesions. طيب وهو زي الفيزيكولر rash, so it's like papules اللي بيكون جوتها زي الفلويد. طبعا intrauterine when it's transmitted it can cause malformation. One of the malformation it can cause skin anomalies and bone anomalies. وهنا تقدروا تشوفوا كيف اللي هو السكن كأنه burned والبونز كده في disproportion في البونز. طبعا هذا اللي هو الفاكسين حقه. البرزنتيشن maternal usually a few days حيكون عندها flu-like symptoms. بعد كده بيصير عندها pruritic vesicular lesions that crest over 3 to 7 days. Mortality is high in adults. 5 to 20% develop pneumonitis. والdeath هنا death usually بيكون due to pneumonia. Fetal, the first half may develop congenital varicella syndrome. What are the features? طبعاً بيكون اللي هو chorioenteritis, microphthalmia, cerebral cortical atrophy, IUGR, hydronephrosis, skin lesions and atrophy of the bone. طبعاً timing of the exposure is very important and it estimates اللي هو الفيتال risk. إذا كان الexposure before 13 weeks of gestation, the fetal risk بيكون 0.4%. If the exposure is between 13 to 20 weeks, then the fetal risk is 2%. If the exposure is after 20 weeks, there's no evidence of congenital infection. What are the symptoms and risk factors for maternal pneumonia? So the symptoms, usually they will present with chest pain, shortness of breath, cough, fever, aching pain, and tachycardia. The risk factors usually having more than 100 skin lesions or if she's a smoker. A diagnosis, usually it's by tissue culture. You can do Xanax smear, direct fluorescent antibody testing, nucleic acid amplification test. And what is the most sensitive? The most sensitive test is the nucleic acid amplification test. The peripartum period بيكون before or during delivery, transmission risk is about 25 to 50%. 25% mortality rate. They should receive اللي هو IVIG 5 days before delivery or 2 days after. The IVIG should be given to the neonates as well. Non-immune female should receive VZEG within 96 hours of exposure to prevent infection. Infected patients should be isolated. If pneumonia is diagnosed, they should be admitted and they should receive acyclovir. Vaccination, usually 2 doses, 4 to 8 weeks apart, and it's not recommended during pregnancy. So if you do a serology for a woman before she gets pregnant, she should have the vaccination and contraception for at least 2 months, and then she can plan to get pregnant. Regarding the rubella virus, so it's an RNA toga virus. Incubation period is about 12 to 24 days. Usually the patient will have flu-like symptoms, arthritis, arthralgia, a rash that starts on the face, then the extremities, and it's associated with lymphadenopathy. Viremia precedes the clinical symptoms by 1 week. It's highly infectious in the 7 days of the rash. The congenital infection and the transmission to the fetus, if less than 12 weeks, the transmission is 90%, or the fetus will have an infection in 90% of the cases. From 13 to 14 weeks, 50%, and the risk decreases with increased age. The diagnosis, you can isolate it in the urine, nasopharyngeal, or cerebrospinal fluid. The IgM indicates active or recent disease. IgM will be elevated for from day 5 of the symptoms up to 8 weeks. And then if somebody has an IgG, that means that they're immune. Okay, so this usually is an exam question, okay? In the IgM, when is it elevated في الرubella, okay? Another exam question is, you can isolate it from the urine. They will give you examples on where you can isolate the virus from. So in the rubella, you can isolate it from the urine. So this is the congenital rubella triad. It's cataract, cardiac abnormality, and deafness. And this is the rash, and usually it's called the blueberry rash. البلوبري اللي هو التوت الأزرق. فمعلش الصورة ما هي واضحة كتير، بس تقدروا تشوفوا كيف الراش زي النقط الصغيرة اللي هي كده لونها حتى بيكون على موف غامق، بنفسجي غامق. So هذا الترياد, it's a very important triad to know, a triad of congenital rubella infection. Congenital infection, they can present طبعا في الآي ممكن تشوفوا cataract ولا ممكن تشوفوا congenital glaucoma. في الهارت ممكن يكون عندهم patent ductus arteriosus ولا pulmonary artery stenosis. ممكن hepatosplenomegaly, jaundice. ممكن تشوفوا عندهم retinopathies. راسهم بتكون صغيرة، بيكون عندهم microcephaly، بيكون عندهم developmental delay, mental retardation, and meningoencephalitis. بيكون عندهم neonatal purpura. بيكون عندهم deafness. والvaccine is contraindicated in pregnancy. Which of the following is the most common intrauterine infection? Rubella, HSV, cytomegalovirus, ولا VARICELLA-ZOSTER virus? طبعا the most common intrauterine infection is the cytomegalovirus. It accounts for 0.2 to 2% of all neonatal infection. Transmission usually is either by direct contact, all body fluids, and by vertical transmission, or from breastfeeding. So any woman that has cytomegalovirus, breastfeeding is contraindicated in this virus. برضو هذا دايما سؤال يسألوه، يحطوا لكم ايش الفيروسز اللي بيكون breastfeeding contraindicated فيها، بيكون دايما يحطوا cytomegalovirus أو HIV. 85% are seropositive. Risk of infection is seronegative in 1 to 4%. Most common, it's the most common cause of sensorineuronal deafness. Okay, هذا برضو دائما يجيبوه MCQ. Which of the following is the most common cause of sensorineuronal deafness? اللي هو cytomegalovirus. Manifestation, most common بيكونوا asymptomatic, about 70 to 80%. 40% of cases will have primary infection, and 1% only will have secondary infection. They present with flu-like symptoms اللي هو arthralgia, arthritis, fever, low-grade fever, malaise. وفي الاميونو suppressed they can present with hepatitis or myocarditis. Meningitis, they can present as well with it, or meningoencephalitis. A congenital infection, usually the baby will present with, will have either IUGR or anemia, microcephaly, thrombocytopenia, cranial calcifications, chorioenteritis, sensorineural deafness. Most are asymptomatic at birth, and then they develop disability and psychomotor hearing loss and neurological defects. Numbers that you need to know, 80% are asymptomatic at birth, 15 to 20% will have sensorineural deafness, 15 to 20% are symptomatic, and 20 to 30% die from infection or liver disease. The diagnosis is a little bit complicated. So in the CMV, you need to do the IgG and the IgM, طيب, and you have to check for the avidity, okay? So if the IgG is negative and the IgM is negative, then obviously there's no infection. If the IgG is positive and the IgM is positive with low avidity, so this means that this is a primary CMV and you have to do invasive testing. Invasive testing زي ايش اللي هو either chordocentesis ولا amniocentesis, depending على which gestational age it was diagnosed. If the IgG is positive with high avidity and the IgM is negative, then this is a latent infection and you don't need further treatment. So if you're uncertain of the serology, then you can proceed to invasive testing. If you have an IgG positive with high avidity and IgM positive, then this is a recurrent and no invasive follow-up is needed. So testing, the gold standard is amniotic fluid nucleic acid amplification test. Ultrasound, you will usually find intracranial calcification, echogenic bowel, والventriculomegaly. So that's for the CMV. في أي أسئلة إلى الدحين؟ طيب نكمل. البارفوفيروس, it's a single-stranded DNA virus. بيكون transmitted by respiratory droplet ولا بالtransplacental. 50 to 56% of women are immune, 1 to 3% of women are susceptible in pregnancy. Al presentation, 20 to 30% are asymptomatic, 80% present with arthropathy, flu-like symptoms, and 4 days later, the rash starts. Myocarditis, they can present with aplastic crisis, anemia and immunocompromised. البارفوفيروس اللي هو السلاب تشيك disease. طيب شايفين كيف كأنه البيبي أحد ملطش وكذا كفوف وجهه محمر. طبعا ممكن يسوي هاي دروبس. طيب فهذه النتيجة حتكون في intrauterine. الترانسميشن is 17 to 33%. It can cause spontaneous abortion if less than 20 weeks. The rate is 14%. Or after 20 weeks, it's about 2%. High drops طبعا بيكون from 8 to 10%. Serology, IgM appears after 2 to 3 days of the acute infection and persists up to 6 months. IgG appears after few days of the IgM and persists for life. متى الفيتس يبدأ يسوي IgM at 22 weeks. هذا برضو سؤال MCQ. طيب, so to understand the serology حق البارفوفيروس, if you have an IgG positive and an IgM negative, that means that this woman is immune or حتسوي لها reassurance or she doesn't need to worry. If she's IgG positive or negative and the IgM is positive, then this means that this is a recent infection. You need to do ultrasound for high drops, transfer to MFM. If no high drops, then you have to repeat the ultrasound between 8 to 12 weeks. And in some books, they say that you have to repeat the ultrasound weekly for 8 to 12 weeks. If you have an IgG negative and an IgM negative, then this means that this patient is non-immune and you need to counsel this patient. Okay, so which is not a blood-borne infection? Salmonella, Listeria, Toxoplasmosis, Syphilis. طبعا من السلايد اللي بعدها هنعرف مين هو. Toxoplasmosis, transmission increases with increased gestational age. في الفيرست trimester بيكون الترانسميشن 10 to 20%. In the second trimester it's 25 to 30%. Third trimester it's about 60%. So transmission usually is due to uncooked raw meat, cat feces exposure that is infected with the oocytes of the toxoplasm, وممكن يكون اللي هو transmission transplacentally. 90% usually are asymptomatic. Incubation period is about 5 to 18 days. The IgM appears 5 days after exposure. IgG appears 1 to 2 weeks after the exposure and peaks at 6 months. The serology, to understand it, so if you have an IgG and an IgM negative, so this means that there's no infection or it's extremely new. طيب لأنه ال IgG وال IgM زي الصفحة اللي قبلها إنه ما بتطلع على طول في حالة التوكسون. If you have an IgG positive and an IgM negative, so this means that this is a prior infection. If you have an IgG positive and an IgM positive, so this means that this is a recent acute infection. So indications to do AMINO in this case, in cases of toxoplasmosis. So if this is a maternal primary infection, you can't confirm or exclude primary infection, or if you have ultrasound features. Ultrasound features like chorioenteritis, calcification. So the treatment عندنا اللي هو maternal infection. Usually when there's a maternal infection, you're going to give her spiromycin, 1 gram PO, every 8 hours until delivery. Okay. If you have a fetal infection, then you're going to give them the pyrimethamine and the sulfazidine. It decreases the severity of fetal infection. To prevent the toxoplasmosis from happening, you have to cook the meat, wash the fruits and veggies, clean the surface areas that you're using, either to cut or chop the fruits and vegetables, freeze the meat, change the litter with gloves. يعني اللي مربين بساس لما يغيروا اللي هو التراب حق البسة, you have to use gloves and always keep the cats indoors. For the syphilis, we said the causative organism is the Treponema pallidum. Transmission usually is either by intercourse, placenta, blood, vertical transmission هو نفسه اللي هو transplacental. Incubation period بيكون from 3 weeks to 90 days. The risk factors usually is substance abuse, drug abuse, HIV, treatment failure, reinfection. Somebody has no prenatal care, multiple sexual partners, ولا اللي هو prostitute. Early stage transmission usually is 30 to 50%. Usually they have a primary painless chancre. Secondary بيكون عندهم condyloma lata في pounds and planters. Early latent reactive ممكن يكون primary and secondary, ولا بيكون عندي late stage transmission, and this is very low. In the primary بيكون عندهم painless chancre, raised red areas, and involves the lymph nodes, and usually it resolves after 2 to 8 weeks. في السكندري بيكون multi system, condyloma lata بيكون it affects the palmar, and the planters بيكون عندهم malar rash and constitutional symptoms. The diagnosis usually with dark field microscopy, direct fluorescent antibody testing, VDRL, rapid plasma regain test. Confirmatory test بيكون بالfluorescent troponeal antibody absorption test, microhemoagglutination assay for antibodies, and AMINO for PCR. هذا السؤال دائما يحبوه. What is the test؟ طبعا هذا dark field microscopy. What is the diagnosis؟ syphilis. هذا برضو سؤال على الالتراساوند فايندينج اللي هو بيكون عندهم اللارج hydrocephalus. طيب بيكون عندهم برضو large placenta, hepatic anomalies, high drops, thrombocytopenia, and they could present with IUFD. التريتمنت usually early إذا كان عندي اللي هو primary or secondary or latent less than 12 months بديهم benzathine penicillin G 2.4 units IM once. Some recommend repeat dose in 1 week. If you have a latent infection, unknown duration, or more than 12 months, then you're going to give them the benzathine penicillin G 2.4 units IM once weekly for 3 weeks. If you have neuromanifestation, then you're going to give them aqueous crystalline penicillin G 3 to 4 units IM every 4 hours for 10 to 14 days. What do you do if somebody is allergic to penicillin? You desensitize them, okay? Erythromycin does not prevent fetal infection, and tetracycline and doxycycline are contraindicated in pregnancy. هذا دايما برضو سؤال يحبوا يجيبوه. إذا somebody is allergic, what do you do? طيب بعد كده نيجي في الناس اللي عندهم سفلس في هذا الديزيز أو الرياكشن اللي هو جاريش هيركزايمر رياكشن أو في ناس ينطقوه يارس هيركزايمر reaction. Okay, so it's caused by penicillin treatment. Usually the patient will present with uterine contractions with late fetal heart rate decels and decreased fetal movement. About 40% of women may experience it. Women with syphilis always should be offered also testing for HIV. طيب لما البيشنت تجيكي بالديزيز هذا you're going to admit her to the labor floor, hydration, and keep her on the monitor, and you will find that this reaction usually resolves. Okay, gonorrhea. So gonorrhea is the second most notable disease in the States. It's high in young women. Risk factors usually include single, prostitution, adolescent, drug abuse, poverty, and STIs. Poverty يعني poor, okay, low socioeconomic status. Gonococcal infections usually is also a marker for concomitant chlamydial infection in up to 40%. يعني دائما الجونوريا والكلاميديا بيكونوا مع بعض. طيب عشان كده احيانا لما يجيكي patient عندها مثلا gonorrhea ولا chlamydia and you treat مثلا الكلاميديا and she's not responding to treatment, you have to treat her also for the for gonorrhea. It's limited to lower genital tract, limited to lower genital tract during pregnancy. It can affect pregnancy in either one of those ways. So it can cause either abortion, preterm labor, premature rupture of membrane, chorioamnionitis, or postpartum infections. The treatment usually is ceftriaxone 125 milligrams IM times 1, or you can give cefixime 400 milligrams PO once, or you can give spectinomycin 2 grams IM once, plus treatment for chlamydia infection unless it's excluded. طبعا plus treating a partner. A disseminated infection usually manifests as petechial or pustular skin lesions. arthralgia and septic arthritis or tenosynovitis. التريتمنت for disseminated infection بيكون ceftriaxone 1 gram IM or IV every 24 hours for 24 to 48 hours, then switch to oral for 1 week. For gonococcal endocarditis should be continued for 4 weeks. For meningitis, you need to treat for 13 to 20 days. Chlamydial infection, طبعاً most are asymptomatic. They could present with urethral syndrome, urethritis, or Bartholin gland infection. Usually they present with mucopurulent cervicitis. Usually no complications in pregnancy. No treatment increases the risk of prenatal mortality. Vertical transmission to neonate is about 30 to 50%. Usually the screening is by culture. The treatment is azithromycin 1 gram PO once, or you can do amoxicillin 500 milligrams TID for 7 days, or erythromycin base 500 milligrams PO every 6 hours daily for 7 days. So this is lymphogranuloma venereum. So what is the cause? Usually it's a transient inguinal adenitis and that causes sclerosis and fibrosis. Can cause a vulvar elephantiasis and severe strictures and fistula. The treatment usually is erythromycin 500 4 times daily for 21 days, or azithromycin given in multiple doses. Bacterial vaginosis, so it's maldistribution of normal vaginal flora. Number of lactobacillus are decreased. Anaerobic bacteria include Gardnerella vaginalis, Mobilicus, and Bacteroid. 30% of non-pregnant women will have BV. In pregnancy, it's highly associated with preterm labor. Usually, patient will complain of fishy discharge, fishy odor, discharge, and pain and erythema. Fishy smell, usually a diagnosis if you do the wet mount, wet test. After adding potassium chloride, you're gonna smell the fishy smell and the appearance of claw cells. So this is not normal vaginal epithelium, and these are the claw cells. برضو هذا السؤال دائما يحبوا يسألوه. Risk factors, usually multiple sexual partner, vaginal douching, antibiotic treatment, use of IUCD. Then you have the AMSL criteria for diagnosing اللي هو bacterial vaginosis. So thin, white, homogeneous vaginal discharge, claw cells on microscopy, fishy odor with potassium chloride, واللي هو pH, vaginal pH. Treatment usually flagell 500 milligrams PO, BID for 7 days, or you can use the 0.75% flagell cream. It comes as an applicator, 250 milligrams intravaginally 3 times a day for 7 days, or you can use clindamycin cream of 2%, 1 applicator BV at HS for 7 days. Then we have the trichomonas. So 20% of women are affected. Usually it causes a foamy leukorrhea with pruritus and irritation. It's a flagellated pear-shaped motile organism. Treatment usually is flagell 2 grams PO once. It causes اللي هو هذا الستrawberry cervix. طيب هذا السؤال برضو دائما يجيبوه في الاختبارات. Oh, this is how it looks like. It's flagellated organisms. Candida albicans identified in 20% in pregnancy. Asymptomatic, requires no treatment, but it can cause profuse irritation, discharge associated with pruritus, tender edematous vulva. Topical treatment is usually recommended. Or you can see how the discharge is usually like the cottage cheese appearance. اوكي. ويوجوالي الاورجانيزم اللي هو اللي بيدوروا عليه في الميكروسكوبي اللي هو السودو هاي. So some كده هذه الكومباينيشن برضو دائما يحبوا يسألوا فيها في الاختبارات، اللي هو الليمفوجرانيلوما فيرينيوم. ايش الكوزيتيف اورجانيزم؟ Usually the causative organism is chlamydia. في الجرانيولوما انجوينالي كليبسيلا. في الشانكرويد هيموفيلس دوكري. في الشانكر اللي هو السيفلس. في السوفت شانكر اللي هو الشانكرويد. اوكي، خلصنا المحاضرة. بالنسبة لآخر سلايد اللي كان فيها الأشياء هذه الكونفيوزنج اللي هي البكتيريا وإيش بتسوي، عادة هذه تجي صور. طيب الليمفوجرانيلوما فيرينيوم والليمفوجرانيلوما انجوينالي هذه كلها عادة يحطوها صور ويسألوا إيش الكوزيتيف أورجانيزم، ممكن يسألوا what's the treatment. السكندري سيفلس دائما يجيبوا عليه صور اللي هو حقة البالمر والبلانتر، يجيبوا يد كده وعادة هي صورة واحدة ما في غيرها، يد سمراء وفيها نقط صغيرة 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 كده، فهذا اللي هو السفلس. ممكن طبعا برضو يجيبوا اللي هي الفالفا ويكون عليها اللي هو الألسرز، سواء في السفلس ولا في بعد كده لما ناخذ ال HSV برضو ممكن هذه تجي صور.
لا في الروبيلا هي لها تراياد صح؟ في اللي في الالتراساوند او يعني
التراياد كانت الروبيلا تراياد.
ايوه اللي هي الكاتاراكت والكاردياك ومايكروسيفالي. طيب في السي ام في، لانه دائما تجي الاسئله على هذا الشيء، في
السي ام في ما عنده تراياد. السي ام في عاده يجوا عندهم اللي هو الكالسيفيكيشنز والسنسونيورال ديفنس، ويكون عندهم اللي هو هايدروسيفالس. طيب والاشياء الثانيه اللي هي الاي جي ار والكذا الاشياء، بس هو دائما الكالسيفيكيشن عندك 3 اشياء اللي بيجي فيها الكالسيفيكيشن: السيفلس سوري التوكسو والسيتوميغالوفيروس واللي هو الروبيلا.
تمام.
اوكي. دائما يحبوا يسالوا عن ايش اسمه ده الفاريسيلا. دائما يجيبوا الصوره حقت البون، هي ما في غيرها، اللي صوره ويليامز اللي كده يد كده نحيفه وبعدين شويه تصير دبه وبعدين ترجع تنحف، اللي هي السكن والبون تشينجز اللي تصير من الفاريسيلا انفكشن. ايش كمان؟ الراش حق الروبيلا برضو مهم. طيب دائما الديستريبيوشن ممكن يسالوا عن الديستريبيوشن اوف ذا راش برضو. طيب انه ممكن في فيروسز الراش يبدا في الوجه وبعدين الديستريبيوت تو ذا اكستريميتيز، في راشز لا الراش يبدا في البطن وبعدين الديستريبيوشن للاكستريميتيز. في احد بيسال في الشات what is the best treatment of postpartum endometritis؟ البست treatment for postpartum endometritis usually اللي هو في التكست بوكس دايما they give اللي هو cefazolin 1 gram every 8 hours مع اللي هو metronidazole 500 milligrams every 8 hours برضو. You cover the patient for 48 hours or until she's afebrile, and then you can switch her to PO to continue for 7 days.